Back pain has become the #1 leading cause of disability worldwide, and that's a trend that's not likely to end anytime soon. Whether you're having pain sitting, driving, bending over, or even just doing chores around the house, this video is designed specifically for you. And this is going to help people that have back pain specifically in the back, but also the people that have sciatic pain going down into their leg. My name is Dr. Andrew Finlinson, and as a physical therapist, I'm here to educate you and empower you to be able to live a life without restriction. And today we're going to focus on back pain and how you can learn to treat your own back and recognize the triggers that are affecting you in your life. First, we need to be able to understand the causes of back pain, what's leading to your pain, and how you can change little things during the day to be able to fix that. There was a study that was done that just assessed people's posture, whether they had back pain or whether they didn't, just to see what they did throughout the day. What they found was that people spent an average about 5 hours in lumbar flexion, so low back bending, every single day. And they spent about 24 minutes in extension. So that's that back, arching back. That's usually when you're reaching up over your head, doing things like that. So 5 hours to 24 minutes, it's a pretty big difference there. Just to go in addition with that, they found that people reached full flexion, so bending all the way over, whether that's tying your shoe, putting socks on, they reached that about 50 times a day, and the average person never once reached full extension during the day. Now, what happens with this is that you begin to have a difference of forces that are happening within the body, within the back. You can kind of see that a little bit if you were to take your finger and bend it back this way. So as you do that, you'd start to feel a little bit of discomfort after a little while. Initially, it might not feel too bad, but after a little bit, you're going to start to experience some pain in that front part of the finger. And this is the same thing that happens with your back. As you bend over, you might be slouching, sitting, watching your favorite TV show, or driving, maybe even just at work. You might not notice any pain, but as you stay in that prolonged position for so long, you'll begin to have that pain that builds up over time. So that's what we're going to be looking at today, is just reversing those postures and those positions that tend to cause the injury and the pain, and be able to just change those little things during the day. So the first thing that I want to be able to assess today is what your pain is initially. So what I want you to think about is, where is your pain? Is it just specifically in your back here in the middle? Is it kind of off to the side around the tailbone area? Is it going down into the legs? And how far down is it going? So what we want to do first is just go through a little movement here. First thing you want to do, put your hands on your thighs and bend forward, going all the way down, keeping those legs straight, and try to get full back motion there. As you do that, what happens to your symptoms? Do they increase? Do they stay the same? Do they go further down or further up? Just pay attention to those things. We'll recheck that in just a little bit. The next one here, hands on the back here. Arch back far as you can. Trying to keep the knees about straight so that way we're not cheating, and we get that full back arch. When you do that, how does that feel? Does that increase, decrease? Just kind of assess that a little bit. These next two are a little bit more difficult. You're just going to stand with your legs straight. Make sure not to bend your knees on this. You're going to keep your shoulders even and push your hips off to the side. As you do this, note where you're having pain. Is it change one side to the other? Does it go further down, or does it stay in about the same spot? So with that in mind, we're going to have you come. You can do this on the floor, yoga mat, on your bed, on the couch, whatever it is. We're just going to have you lay on your stomach here. So you're going to lay down and just rest here. Stay here for about 30 seconds or so. Just make sure that this is feeling okay. So we want to be able to guide this a little bit at a time. After about 30 seconds, we're going to prop yourself up onto your elbows and just rest in this position. So kind of what I was mentioning before, if you're in that prolonged position for long periods of time, you'll begin to have a difference of forces that are putting stress on the ligaments and different parts of the spine that can cause irritation either in the back or down the legs. Now, when you're in this position, I want you to focus on a couple different things. One is the intensity of pain that you're experiencing. So if you had about a 5 or 6 out of 10 pain before you did this, and now you're laying down on your stomach, and as you rest here, does that pain increase or does that decrease? If it's increasing consistently, this probably isn't the thing for you. If it's decreasing though, this is a great sign and that we're on the right track here. If there's just not quite a change yet, there's more that we're going to do here. The other thing to pay attention to is this going further down the leg if you have sciatic pain, or is it coming out of the leg? And if it's coming out of the leg, it might be coming up closer to the butt, up into the back, and occasionally that can increase pain temporarily in the back. But as long as it's coming out of the leg, that's actually a good thing. We're trying to draw that closer to the root cause of the pain. Now, after laying here on your stomach for about a minute or so, just to assess your symptoms, we're going to do 10 presses to end range extension. So you're going to have your hands down like you're going to do a push-up. Press yourself up. Come to that end range. You don't have to stay there for very long, and then just come back down. We're going to do about 10 of these here. And again, just assessing your symptoms. You might even get a little tricep workout as you go. We'll just keep going there. After we do this here, we're going to recheck our symptoms to see if there's any difference in the 4 different directions that we looked at earlier. Again, just full end range. Try to lock out your elbows if you can. If you can't, that's all right. The other thing to focus on is as you do this, try to let those back muscles and the butt muscles relax. It's going to be a little bit hard if you're stiff, but do your best to let those just relax and sag. After 10 of those, step off the table or get off the floor, whichever it is, and stand up. Try to do so without bending your spine. Now we're going to recheck those 4 directions. So you're here, hands on your thighs, bend forward for me. So compared to the first time that you did this, is there any difference? Is it worse? Is it a little bit better? Just take a note of that. Second thing is that low back extension, seeing if there's any difference there. And then we're going to check the side to side directions like we did earlier. The side and off to the side. So a lot of times, even if you've been having pain for a long period of time, just getting to that end range can decrease those symptoms very, very quickly. Now, as we're doing this, if you didn't have any change yet, that's okay, we're not quite done yet. If you had a little bit of pain that seemed to be there, but it just, as you stand up, that pain decreased, that's okay, we're on the right track. If you had intense pain that stays and sticks around, this probably isn't the video for you. We'll find another way to be able to help you later on. But if that pain decreased again, then we're okay, we're good to keep going. If you had just a decrease in pain overall, this is perfect. This is absolutely going to help you, and you'll likely have pain relief very quickly. So if you did have some pain relief, we'll go back, we'll do another 10 rounds of that, and just keep doing that a little bit, and your pain should just go decreasing every time you do those 10 repetitions. If you had a little bit of pain relief, but just not quite there, or if you didn't quite have pain relief, there really just wasn't a change one way or the other, we're going to do a little tweak here. We'll go back onto the table on your stomach. You're going to do those 10 presses, but on the last 3, we're going to add just a little tiny change where you'll take a deep breath into the stomach, into the diaphragm, and then as you exhale, you'll let everything just relax, and this will cause a little bit of overpressure. I got a little pop there too. So just allow the spine and the muscles to relax that much more. Go one more there. Come up, deep breath. And deep breath out into the stomach. Good. So now come up. And we're going to recheck your symptoms. Same thing as before. Hands on your thighs, bend forward. Hands back here, coming backwards. And then the side to side. Now, again, with that sciatic pain, if you're having that, that should come up out of the leg, closer to the back. Even if that's there just a little bit, as you continue with this, that should go decreasing. And with your back pain, this should go decreasing as well. Now, the big question is, if I've experienced some relief now, how do I get that to stick around? So for the first little bit here, we're going to want to do this exercise, just that little extension, every couple hours for the next week or so. So every 2 hours, if you're able to find a little spot on the floor or anything there, just to be able to hit that end range of extension, go about 10 repetitions, and you can go back to your day. If this is just super, super hard for you, if you're at work or whatever, and you're just not quite able to find some way to do it, another way you can do it is just finding a wall or a table, a desk, anything like that, and then just going into that extension the best way you can, just leaning forward and finding that arch in the back. So just little tiny things that you can do throughout the day. As best you can, try to get that arch every 2 hours for the next week or so. The other thing is to try to avoid bending over as much as you can, whether that's picking things up or just doing different activities during the day. And also just with your sitting posture, try not to slouch as much as you can for the next week or so, just to allow that to recover. If you picture here, if you got a cut on the back of your knuckle and the whole day you're just bending your finger, bending your finger, bending your finger, it's going to be very hard for that injury to heal. But if you allow it to rest a little bit, allow those tissues to heal up and to seal, then you can eventually go back to that bending motion. And it's the same thing with our back. With that injury that we have there, we need to be able to give it some time to heal up properly before we go back and reintroduce those activities. You will be able to do those things again. Now, a couple things that will help you with this. So the first, lumbar support. That's going to be key for you if you're sitting down, especially if you have a work job or you're driving a lot, or just anything that you're sitting for a long period of time, even watching TV or reading a book. Put something behind your back. This is a Mckenzie roll. This is developed by the people that came up with this system and that have been tried and tested. This is something that you can just put right behind your back, and it will help you to keep you upright, prevent that slouching. And that's going to be very important for the first little bit here. The other thing is a book that was written by Dr. Mckenzie, and this is the whole treatment process. And the book is actually called Treat Your Own Back. So that's the whole process here. The whole idea is to be able to help empower you to be able to recognize your symptoms and know what to do to take care of that pain. I'll leave a link in the description here if you want to purchase this book, or even just a lumbar roll, just to be able to help you on that journey. I've actually read this book and it's been really encouraging and enlightening for me to be able to understand what causes back pain, what I can do, and even just step-by-step things. There's pictures with it and other things just to be able to guide you in your journey to relieving your back pain. I hope this video helped you to be able to decrease your back pain and your sciatic pain, as well as build up that confidence that this back pain isn't something that's going to be an issue for the rest of your life. Make sure to subscribe to be able to educate and empower yourself on how to treat your body and live a life without restriction. We'll see you in the next one.